The World Bank has sounded the alarm over the deepening global sanitation crisis, revealing that nearly 2 out of every 5 people worldwide still lack access to safe sanitation. According to the institution, this gap has severe consequences for public health, economic growth, and the environment. In a report released on Tuesday titled "The Global Sanitation Crisis: Pathways for Urgent Action," the bank explained that Africa alone loses as much as $200 billion annually in economic gains due to poor sanitation. It further noted that the continent's GDP could increase by up to 5% if governments invested adequately in water and sanitation services. The report describes sanitation as one of the most pressing development challenges of our time. United Nations estimates indicate that about 3.5 billion people globally lack access to safe sanitation facilities. This has fueled the spread of preventable diseases such as cholera, diarrhea, and typhoid diseases, responsible for hundreds of thousands of deaths every year, particularly among children under 5. In Africa, the problem has been worsened by rapid urbanization, poverty, and weak infrastructure. Many formal settlements in major cities still lack functional sewage systems, forcing residents to rely on unsafe alternatives that contaminate water sources. The World Health Organization also stressed that poor sanitation not only spreads disease but reduces economic productivity by keeping children away from school and adults away from work. Both the UN and the World Bank have tied improved sanitation to the Sustainable Development Goals, especially Goal 6, which calls for clean water and sanitation for all by 2030. Yet, progress has been slow due to funding gaps, weak policy frameworks, and the growing impact of climate change. The World Bank report emphasized that the heaviest burden falls on low and middle income countries. It warned that worsening climate threats such as flooding, drought, and rising sea levels are placing fragile sanitation systems under increasing strain, resulting in significant GDP losses. The bank argued that smart, resilient, and citywide sanitation investment could break this cycle, turning sanitation into a driver of health, job creation, pollution reduction, and urban resilience. Economically, the bank highlighted the cost-effectiveness of sanitation investments. It noted that every dollar spent on water and sanitation in Africa yields a return of $7. Beyond financial gains, improved sanitation systems could cut global methane emissions by up to 10%, protect ecosystems, and secure cleaner water supplies. The report also linked better sanitation to improved education outcomes. In India, the provision of sex-specific latrines in schools led to higher enrollment, particularly among adolescent girls, while in Brazil, access to sanitation has been associated with more years of completed schooling. To address the crisis, the World Bank recommended urgent collaboration among governments, cities, service providers, and communities. It called for 3 major steps: prioritizing sanitation policies and funding at all levels, designing inclusive and climate-resilient urban sanitation systems, and supporting technological innovations while training workers to manage new systems effectively. The report further emphasized that investing in inclusive sanitation has circular economic benefits, such as human waste can be transformed into resources for energy, job creation, and water reuse. Such efforts, it argued, would not only protect vulnerable communities, but also strengthen ecosystems and enhance global resilience. The World Bank concluded by stressing that climate-resilient urban sanitation is achievable but requires immediate action. It urged all stakeholders, governments, businesses, and communities to work together in building systems that safeguard human health, boost prosperity, and protect the planet.